If you're over 50 and you recently had a knee joint replacement surgery, you might be struggling to get that knee bend happening, okay? So it might seem very frustrating. It might be very slow. So in this video, we're going to show you a proven exercise. It's actually one of my, it is my favorite exercise to get more knee bend after a knee replacement, after being a physio for 22 years. So here it is. This is how you do it. Okay, so all you need is a chair at home. And by the way, I wouldn't do this exercise probably in your first couple of weeks after surgery. Okay, you need to be you probably need to be at least 2 weeks after surgery to start doing this exercise. Okay, so this is how you do it. All right, you're going to sit on the chair. Okay, I'm going to show you how it's done. So you're going to, let's say it's my right leg that's been operated on, okay? What you're going to do is you're going to bring your right foot as far back as possible. So I'm going to use my left foot to give me a bit of help. I'm going to use my left foot to push it back as far as I can, all right? So that's it. Let's say there is pretty much, I can't go further back than this, and this is as much bend as I can get, right? So what I'm going to do now is I'm going to sit on my chair, and all I'm going to do is I'm going to start shuffling my hips forward a little bit, okay? So I'm going to shuffle my hips forward. I'm going to lean forward a little bit, okay? Now, as you can tell, as I start to move forward, I'm going to automatically get a little bit more bend in my knee because my foot is staying still. My foot is staying exactly where it was before. All I'm doing is I'm shuffling my hips forward, okay? And depends how far you can go. Like, don't force it too much, but it's okay to have a little bit of discomfort in your knee. And because you're using your whole body weight to push your knee into a more bent position, this exercise is actually very, very effective. Okay. So again, go as far forward as you can and just stay there for 5 seconds, and then you can let go a little bit. You can move back again. Okay. And then you do it again. So you repeat the process. Again, you shuffle your hips forward as far as you can. You'll probably see that every time you go forward, you could go a little bit further and further and further. So this is all about repetition. The more you do it, the better you get at it, okay? So you can do sets of 10, so you do 10 reps, then have a couple of minutes rest, and then do it again and again. So probably do 3 or 4 sets of these, and you can do it a few times a day. And look, in most cases, this is very effective. Watch your pain levels. If it gets too painful, just back off a little bit. But honestly, this is, in my experience being a physiotherapist, I would say this is probably the most effective exercise to get more knee flexion, knee bend happening, particularly after a knee replacement.
So what would be like the maximum bend you're going to get after a knee replacement? Does it ever come back the same, or does it?
Well, no, everyone's very different. So some people get stuck at 90 degrees. Some people actually do really well. They can get to even like 130, 135, which is almost normal. I would say to be functional, to do most of your day-to-day activities without too much restriction, you need 110 degrees, okay? So 110 degrees is about somewhere around there, okay? So it will enable you to squat down, to get down on the floor, get off the floor, that kind of thing, without too many issues. If you can get to 120 degrees, that's even better. That just means that pretty much 95% of things you want to do, you'll be able to do. Yeah, sure. Okay. Yeah. So that's what to aim for. But again, like, keep in mind, everyone's different. If you're struggling with knee bend, it's not your fault. Sometimes it's just the way your body heals. Some people get a lot of scar tissue in their joint after surgery, and that could be the reason why you're struggling to bend your knee further. But yeah, I mean, either way, this exercise will usually help.
All right, team. So give it a try. Let us know what your thoughts are. What sort of bend have you got on your knee? If you had knee replacement, let us know how far you can go there, because obviously it is very different. But like, again, if you can get 100 degrees or so, then you know you're doing really well. You're on the right track as well. So if you are looking for some kind of strength guide for your knees, we've got a guide that's been downloaded many times now. All you do is comment knees down below, and we'll send you that guide absolutely free. If you are experiencing pain though, we've put together a really excellent pain guide that teaches you when to sort of push into pain and when to come back from pain. And it's based on a traffic light system. So if you would like a copy of that pain guide, comment traffic lights in the comment, and we send that over to you as well. But if you do like the video, let us know. We're going to leave another video in the top corner there, which we think you will like. So head over there, and we'll see you shortly.